Good evening, everyone. I'm Deacon Jim Vargas, and I appreciate you taking the time this evening to join us and to be with us for our Investor Call of 2025, which is sponsored, by the way, by Qualcomm, our visionary corporate sponsor for this year and into next year as well, our 75th anniversary. So we've been celebrating throughout this entire year, 75 years doing God's work here in the East Village of San Diego, the city of San Diego. Lots that we've done, and we'll cover that, and lots more to be done as well. We've been a cornerstone here in San Diego, saving lives and changing lives for the better. We've evolved strategically over time, and we seize each and every single moment with compassion, resilience, efficacy, and ingenuity, and that's what it's all about. So as we get started with our presentation here, what I want to particularly call to mind is a thank you. A thank you to each and every single one of you, because you've been our strategic partner, for some of you for pretty much since Father Joe Carroll came onto the scene in the 1980s. And so we are only able to do our work because of this continued partnership, so I can't thank you enough. And I should say, by that way, I should have started with some housekeeping. You'll notice that you're muted, and that will be the case, but we invite you to ask questions through our chat feature. So by all means, do utilize that chat feature, and at the end, we'll be accessing those questions, and we'll be answering those questions. So again, we've been at it for 75 years, and I have with me this evening two of my team members, valued team members, and one is our Chief Client Services Officer, Jesse Caseman, and the other one is Dr. Megan Parch, who's our Chief Health Officer. And you'll hear from each of them. Of course, Dr. Parch will be speaking about all the health-related programs and services that we offer. And then we have Jessie, who's been with us for a fair number of years, and she'll be talking about all the various programs. And as you can see, as you will be able to see, adapting to each and every single situation, making sure that we're responsive to what's happening on the streets is what makes a difference, and it's what's made us successful throughout these 75 years in helping people to gain self-sufficiency. And our clients is what it's all about. Our clients come to us and they are ashamed, they're anxious, they've been in unsafe situations, and we see the inherent dignity that each of them has. We recognize the potential that they have, and we reinstill hope. Right? We stabilize their situations, initially through shelter, our shelter system, and the comprehensive services, and then we provide housing. We are a beacon of hope for them so that they can come to recognize that, yes, they can be in a better situation. You see right here, Father Joe Carroll, in his quote here, it's all about neighbors helping neighbors. Right? That's what it's all about. We see that the individuals who are in the streets, their circumstances are not what define them. Right? They're defined because they are made in the image of God. And frankly, I often think that but for the grace of God go I. And so they may have never imagined their situations. They may have imagined that behaviorally they'll be impacted, or medically they would be impacted, right? So we help them in the situations, we share in their humanity, and then we help them move forward. As I mentioned, you are who make a difference in the lives of these individuals. It's your philanthropy over the years that has done that. You can see in this chart that by far philanthropy is the largest piece of the pie here by about 55%. We have government funding as well, and we have other types of grants funding and the like, but by far 55% of philanthropic support is what makes us effective. We're a one-stop shop. We have our comprehensive programs, and we're able to really meet people where they are, treat them in their unique circumstances, because everyone's situation is different, in order to be most effective in how we apply the resources, so that we can also use the dollars, the precious dollars that are entrusted to us. We can use them as efficiently as possible. The whole situation is to be able to empower them so that they can achieve self-sufficiency. This collage really sends a very clear message that it's neighbors helping neighbors. Right? That's as you see here, you are the most powerful asset that we have. And and of course, government funding, as I mentioned, is a part of what we have. But government funding, as you've heard recently, is very precarious, right there. And so it's opened up a vacuum for us, wondering, how exactly are we going to approach the work that we do, because of different government requirements and so forth. So, as you look at this chart, those of you who were on our last investor call a couple of years ago, you may recall that I mentioned that we were seeing more and more people fall with substance use challenges, basically, and out on the streets and cycling in and out of our own shelter beds, as well as other provider shelter beds as well. And at that point in time, I mentioned that it was an area of focus for us. Now I'm happy to report that within a couple of weeks, we'll be opening up a detox program. It'll be 44 beds. It'll be an inpatient intensive 14-day program to help people wean off of substances, and then to be able to enter our recovery and sober living area. We have 248 beds so that they can continue their recovery after the 14-day program, and then be able to be case managed, take advantage of our employment center, and then into housing and self-sufficiency. And that's who we are. We always, we're constantly assessing the situation, because the face of homelessness changes. And the reality is that the needs of those who are on the streets change over time. And just in the 11 years I've been here, there's an older population. I'll be talking about the seniors and the impact that we're seeing on the streets as far as seniors are concerned. The key here is to see the need and then be as impactful as possible so that we can lift them out of their circumstances. As I mentioned, we are a one-stop shop, but we are very holistic and client-centered in our approach. As you see here in solving homelessness, when I want to explain what we mean by when we say we solve homelessness. Because there's a lot of frustration out there. I think and understandably so. I think the community, when they think that the situation has gotten worse and worse over time, and they wonder whether homelessness can ever be solved. And the reality is that we solve homelessness each and every single day, one life at a time. And it's not a matter of solving homelessness for an individual overnight. There are a lot of touch points that we have. And with each and every single one of those touch points, we are helping to solve homelessness in the life of each and every single person that we serve, and that's the key. Because imagine a day without Father Joe's Villages. Thousands of individuals, including children, seniors, and veterans, would be going hungry. Thousands of our clients would sleep on the streets. The life-saving medicine would not be administered, and dozens would be dying on the streets as a result. The cycles of homelessness would continue. The preschool-age children would miss out on their education. Women, including pregnant women who we love serving, right, would risk being on the streets and risk of violence and rape. Rooms would be even more overrun with the emergency rooms, I should say, would be even more overrun with sick people dying and people living on the streets. Communicable disease would be spread as a result. Hundreds would not benefit from our employment and education services, right? All these things would happen if we were not on the scene. And so, as you can see, Father Joe's Villages, because we are on the scene, and because we have been on the scene for 75 years, we've been able to solve homelessness, and we do solve homelessness one life at a time, maximizing success and self-sufficiency. And we do it through our pillars of care. And you can see here in the next slide, you can see exactly that we do it in 4 ways. We meet their basic needs, we invest in children, we make health a priority, and we empower self-sufficiency. Dr. Parch and Jesse will be touching base on each and every single one of these, but let me just touch base as well on a few of these as well. Think about the almost million meals that we serve on a yearly basis, right? Breakfast, lunch, and dinner in our 2 dining rooms, right? Again, meeting that basic need. The hundreds of shelter beds that we deploy on any given night, each and every single year. The fact that we expand those shelter beds during the winter months in order to take people off the streets during inclement weather as well, right? The fact that we're able to offer employment services and education for individuals, because we know with the vocational training that we offer that leads to income, to employment, I should say, and then income and then self-sufficiency, right? The children, these precious children who, if not for the services that they receive from us, are 4 times more apt to be homeless in adulthood unless we mitigate their circumstances. This is exactly what we do through our recognized pillars of care, right? This model that we have, and we partner with schools like UCSD as well, and Dr. Parch will talk about those partnerships as well. This is how we make a difference through these pillars of care. Here, this slide here, I mentioned our client service and holistic approach. We, as you can see from what this shows here, UCSD, and in the fact that as people cycle through the shelter system, right? UCSD study has shown that a lot of shelters are not equipped in their diversity to basically to address the diverse needs of individuals, right? And we at Father Joe's Villages, we make it a point, we make it with our shelter system as an example, to make sure that families have individual units because they thrive in individual units. We make sure that there is sober living for those who need sober living. We make sure that there are shelters that have low barrier to entry. Why? Because we understand that individuals who are on substances, as an example, and may not be at a point where they can come off of substances, that to leave them on the streets would be relegating them to death. And so as a result, we adapt to their need, recognizing that, again, there's no use while on campus, but we recognize that they do struggle with their substances. This is what makes us unique. In 2024, as you can see from this chart, we served almost 12,000 individuals. 1,000 of them were children across 500 families, and you see the demographic distribution here as well. And in the past 10 years, you can see here we've served almost over 111,000 individuals, including 3,000 children, almost 9 million meals that we've served, and 21,000 individuals who we've helped through our health center as well. So let me tell you a story, right? Because it's good to, so that you recognize that yes, there are numbers, and heaven knows we have a lot of data points, and data is what drives the work that we do, because we want to make sure that we are as effective as possible. But that said, we can't lose sight of the fact that behind every single data point is an individual. And I'd like to just share one story, and it's the story of Amber. And we have many success stories, but Amber has a soft spot in my heart because of the difficulties that she's had in her life. And she's going to tell her story in a video. But before we get to that video, I just want to mention that Amber is the mother of 2 children, age 6 and age 4. Elia is age 6 and Liberty's age is 4 years of age. And she is someone who literally died through a drug overdose and fortunately was brought back to life. It's what happened at that point in time and thereafter that makes Amber such a strong woman, and a woman who I admire. And so I'm going to, if you give us a second, we'll share a video, and you can hear her story in her own words.
To really meet people where they're at and just treat them with respect and dignity is one of the kindest acts of humankind can do to another. Gratitude is my attitude, because I was dead. I was literally dead, and God gave me another chance at life. Village Health Center, first and foremost, they are once again another family to us. I got my prenatal care there, and Mark Stevenson, he has been my therapist now for, I want to say 4 or 5 years. He really held that light for me when I couldn't see it for myself. I still have a voicemail saved from him when I first got sober, and I was in the hospital, and he left me a voicemail and was just telling me how proud he was of me, and just keeping on, and all the, my husband was dying in the hospital, and my kids were in foster care, and yet I was like, no, I'm gonna do this program. I literally had every barrier in front of me to fail. After I had our second daughter, my husband had 4 more strokes after that. I all of a sudden had a toddler, a newborn, and a sick husband, and I literally was lining them up and changing all their diapers at once. And then my husband, his cancer came back, and he was hospitalized, and at this point there was just really nothing they could do, and that's really when my addiction took turbo drive. I had my aunt living with me, and unfortunately she's the one who introduced me to meth. And so it was very toxic all around. So fast forward to June 2021, I accidentally overdosed on fentanyl. A week later, CPS got involved, which was sort of my worst fear because I was also raised in foster care myself. I was scared straight of drugs. You know, while I was waiting for an inpatient bed, I ended up detoxing myself at home. You know, Dr. Carrera early on taught me, you know, you can do hard things on your own. It's such a simple statement, but that was the one time I really believed it, that I could do hard things on my own. So fast forward, I worked really hard. At the time, I was getting more unsupervised visits with my kids, but right when I got them back, a week later, I got a pay or quit. And I was like, what am I gonna do? I just got my kids back. They ended up getting us in to Father Joe's the day before the sheriffs were gonna come, the day before. I mean, it was like a warm embrace. I mean, I still remember the first time I just was able to put my head down at night, just to have everybody just welcome me and just support me. It was a huge weight off my shoulders. Like, okay, I have secure housing. Now I can relax for a little bit. I can focus on my recovery. I took 2 job training programs. I first started there, but you know, therapeutic childcare was really nice. Made it really like a very safe place. And because I had that, I was able to try and put myself out there. I applied for my townhouse in Chula Vista, and a week later, I got it. We have a 2-bedroom, 1.5 bathroom townhouse in Chula Vista, and my kids are thriving. That last piece of being self-sufficient was a permanent job. I applied with PATH as a homeless outreach case manager, and the day after my job at H&R, I got my start date and final offer letter with PATH as a homeless outreach case manager. It's just a full circle moment for me that, if you think about it, 1.5 years ago I was still utilizing Father Joe's, and now I can say, hey, this is what helped me. I hope it can help you. And it's the same thing what Mark did with me. He just held that light for me. So I'm really excited about being able to hold that light for people when they cannot see for themselves. It's because of that foundation that was built. I got my confidence reinstilled. I got tons of empathy. They really care about me and my family, and it's so amazing to have that. Technically speaking, it's so easy for you guys to just say, oh, you're good. You know, we did what we need to do, and add me as a statistic. Like, oh, we got her housing, she's doing good. No, the fact that, like, it doesn't stop once I leave Father Joe's. I'm so grateful for the life that I have. Not only do I have a new job, and I have income, and I can provide for my kids, but I can also share these resources with other people. These same resources that changed my life for the better.
I could not have said it better than Amber herself. I'm so very proud of her. And her daughters just absolutely adore her, and understandably so. So she went from literally dying from a drug overdose to recognizing that she had to be there for her kids. And her kids were taken away by CPS, and now she's regained them. And she took full advantage of our many services, from the healthcare in the health center, to our employment center, right, to the therapeutic childcare center for her children. To talk about our comprehensive services, I mean, they are embodied in Amber and her 2 children as well. So I'm extremely very proud of her. So let's put this in perspective. Across our great nation, there are almost 1 million people, 750,000 people who are homeless. 35% of whom are unsheltered. They have no level of shelter at all. When we bring this down to the California level, you see that California has 25% of those who are homeless in the United States. And of that number, 2/3, 66% just about, are unsheltered. That's in the state of California. Then when we bring it down to our level, in San Diego, you'll notice that we have almost 10,000 individuals who are homeless, and almost 60% of those are on the streets and are unsheltered. And here in San Diego, for the last almost 3 years, with the exception of just a few months, in each and every single one of those other months, more people have been falling onto the streets than are being helped into homes. It's as if we're hamsters within this circle, right? And that is as a result of, again, not having enough shelter beds and also not having enough affordable housing, because the reality is that the shelter system is clogged, since we don't have places where we can move people into housing. And then as a result, we can't alleviate the shelter beds for other individuals to come off the streets. So we know that in the point in time count, and this is distribution right here, we see how it's impacting different demographics, whether it's veterans, families, youth, right? And I'm going to talk specifically, in fact, about how it's impacting the seniors themselves. So before we talk about the seniors, what are the root causes of homelessness? And I'm asked that very, very often, actually. The number one reason why people fall into homelessness is an economic one. It's extremely expensive to live here in the city and in the county of San Diego. The average rent is about $2,500. The rental vacancy is quite low. And as a result, when apartments come onto the market rate apartments, again, $2,500 for an average apartment, it's scooped up by individuals who are not within the population that we serve. Obviously, it's because it's beyond their means. And by the way, in the shelter system itself, for every 10 individuals, let's say, who present themselves on a daily basis, only one individual is afforded a shelter. Why? Because there aren't enough shelters, right? And then, of course, when people are on the streets, then they develop a whole host of other issues, physical issues, behavioral health issues. They experience a lot of violence on the streets themselves. So as we go to our next slide here, right, you see, let's talk about seniors, right? The seniors who are experiencing homelessness, there are 5% more seniors on the street this year than last year. The baby boomers are aging out of the market. And unfortunately, they don't have the means here to be able to exist, basically, or to live within the expensive and the expense and the inflation here in the city of San Diego. And so they've been hanging on by their fingernails, and we're finding them more and more falling onto the streets. 25% are nutrition insecure. Over 50% are housing insecure, right? 30% of those who are on the streets are seniors, and that's 55 or 60, those who are 55 or 60 years of age and over. 30% of those who are on the streets are seniors. Seniors are on a fixed income, right? And with the cost of living increasing, right, and their earning potential decreasing once they retire, again, that's forcing them onto the streets. So this is more and more a focus of ours, and we'll continue. Just like, as I mentioned a couple of years ago, when we started focusing on substance use and the challenges there, we're going to be really laser focused on the senior population, because we need really to help them out of their circumstances. They have health issues, there are economic issues, there are societal issues that are at play as well. You know, it used to be that the younger population would take in their parents and their godparents. Well, the younger populations at this point in time are not able to do that, right? So while in the past, again, parents would go and live with their children, that's not the case as much anymore. So it's become quite a difficult situation. So anyway, a focus of ours. I want to turn it over now to Jessie Caseman, our Chief Client Services Officer, so she can talk about the various programs that we offer, the various programs and services that really make a difference in people's lives. Jessie?
Thank you, Deacon Jim. It's such a pleasure to be here with everyone tonight. My computer had different ideas about Zoom backgrounds, so you get me with the tan curtain. Next slide, please. Next slide. Okay, so at Father Joe's Villages, our team strives to intervene and engage with a household wherever they are in their housing crisis, and that includes while a household is still housed. In our Father Joe's Villages properties, we have on staff tenant services coordinators, as well as many case managers, property managers. But those tenant services coordinators are working really closely with all of the tenants in the building to determine what kind of support and resources that they may need to build community through activities and outings, and also to connect our tenants to basic needs like our emergency food pantry that we operate at Father Joe's Villages. And in the event that a Father Joe's Villages tenant needs support paying their rent, we now have a homeless prevention program for which they may be eligible. Prevention in the world that we work in means preventing clients from becoming homeless. So if we can work with a tenant who is currently housed and prevent them from ever ending up on the streets, the National League of Cities tells us that that could save taxpayers approximately 49.5% in the annual amount of dollars that we're spending and working with a household. Um, if a household does end up becoming homeless, then we have a creative team of assessors that are working with the unhoused individual or household and looking for ways, really out of the box ways, that we can quickly get that person off of the streets or out of shelter and into a more safe destination. The team has been so creative, and I have so many stories that I could share, but one of my favorites is just a story of a household that was here from Oregon, where their family was. They had come to San Diego. They had some vehicle problems, and we were contacted by another provider in the community. They said, "Can you guys help?" The team was able to get the vehicle repaired, put some gas in the vehicle, give them a gas card, and get them back to their family in Oregon, which is where they wanted to be. So it's that quick thinking, debit card, and the ability to move quickly that really helps us to find great success with our diversion population. So again, prevention is preventing people from becoming homeless in the first place. Diversion is quick work to divert people from the homeless system and get them into the resources that they need very quickly so that we can save those limited shelter beds for individuals who don't have any other option. Next slide, please. I'm really proud of our team for the way that we listen to the clients that we serve. Back in July of 2024, an example of the way that we listen was that we surveyed all of the clients living in our Palmirable Center, where we had 350 emergency shelter beds for individuals, adults experiencing homelessness. And over 70% of those 350 clients told us that they would like a sober environment to live in. It could be that they had struggled with drugs and alcohol themselves, or it could be that they just didn't want to live around others who were using drugs and alcohol. And so in January of 2025, just a mere 9 months ago, we opened our program called RISE, which stands for Reaching Independence and Self-Empowerment. Deacon Jim referred to this program. This is 248 beds for single adults in our Palmirable Center. It's a 1-year maximum length of stay. It's a sober environment filled by clients who are committed to abstinence from all substances, including alcohol, and really, with some requirements that they're working with case management, that they are really striving towards getting income and exiting to permanent housing or more stable housing as quickly as possible. We also have a similar program across the street in our Joan Kroc Center, which is called our Family Empowerment Program. Our goal there is to create a space for families who choose to live around other families who are committed to abstinence from substances. So to qualify for that program, all of the adults in the program have to be committed to abstinence. At least one adult in the family, if there's more than one adult, at least one adult has to be working or in one of our job training programs. And if they do that and then also have met some qualifications like taking our Challenge to Change curriculum, working with our therapeutic childcare program, and really being committed to case management, then they get a step-up room, a VIP room, if you will, with some extra amenities like new ceiling fans and updated bedding and different, accent walls and things like that they can stay in for up to 1 year with their children. And that is on our second floor of our Joan Kroc Center. So those are just two ways that we can look at the choice of our clients. It doesn't mean that these are the right programs for every single client, but we want to make sure that we're listening to the people that we serve and giving them choice where they live during their housing crisis. Next slide, please. So speaking of families, and Deacon Jim referenced, every individual is different. Every household that we serve is different, whether they're a family or whether they're a single adult. But while we're talking about families, the Joan Kroc Center Family Shelter serves families with children. So when I'm talking about families right now, I'm talking about family defined as one or more adults living with one or more dependent or adult children that are dependent for whom they are the legal custodian. And so in our Joan Kroc Center, we have 52 rooms for families, and that's 246 beds. The Family Empowerment Program that I just briefly spoke about for our families committed to abstinence take up 10 of those rooms. And then we have the St. Margaret of Cortona Harbor program that we lovingly refer to as SMOTCH, which is another subset. Another 5 of our rooms are used for up to 10 families led by women who are unaccompanied by another adult. So they are the only adult in their family, and they have recently had an infant or are expecting, currently expecting a child. And so those women can stay in those semi-private rooms for up to 1 year after the birth of their child. And we definitely are working with them not only to create a birth plan and make sure that they feel safe in bringing their child home, but then after they have their child, really getting them back into a routine and identifying how they can quickly bring on income and exit with their new baby. And so far, we have had over 20 babies that have been born in the program, and it's just a lovely little subset of the program that we serve. What makes it so different is that a woman who is expecting and is not accompanied by other children is not going to qualify for any family shelter. So she would typically go to a singles shelter and then move to a family shelter after having her baby. So St. Margaret of Cortona Harbor really creates that safe space for a woman to prepare for the birth of her child, to be able to focus on prenatal care, and then know exactly where she's going to when she returns from the hospital. But we don't just serve families at Father Joe's Villages. And we, as Deacon Jim referenced, are seeing so many people that are older that need our services. And so we recognize that those who are 55 and older may need a specific space that they can stay because of economic reasons. And so one of the programs that we're currently operating is a shelter space for seniors, senior adults at the Veterans Village of San Diego campus. That's a city-funded shelter for single men that are 55 and older. We have 18 beds over there. Those are 18 beds in 9 units. So they're semi-private apartment units that the men are sharing and can stay there indefinitely. There's no maximum length of stay. I remember one of the men moved in on the first day and he was like, "Oh yeah, this is where I'm staying." So our team is working hard with them to identify that this isn't the forever plan. This is still just a shelter, but working with them on, exiting and really identifying if there's any way that we can increase their income if it is economic reasons that have caused the homelessness, and then determining how quickly they can move out and to where that can happen. Families also include pets. Father Joe's Villages is really a step ahead of most shelters in the country. We've received national recognition of being a leader in the space called co-sheltering. That is where you co-shelter people and their pets together. We don't want an animal to be the reason that someone turns down a shelter bed. So in 2020, Father Joe's Villages made the decision to become 100% pet inclusive in our shelter beds. And that has been a very successful decision that we've made, and it takes away one more barrier to entry. So we want to serve families however they come, regardless of age, regardless of whether you're pregnant, with children, without children, a single adult, you want an abstinence space from substances, you don't want to live in a space where you can't use substance, and if you have your pet, come on in. Next slide, please. We also recognize that shelter and the typical shelter delivery may not be all that someone needs. So we do have 28 beds in our recuperative care program, soon to be 38. We just received a grant that will allow us to grow our beds by 10. So we'll be providing 38 beds of recuperative care. The recuperative care program supports individuals who need time to heal. So most of those folks coming to us are coming from a medical environment. So from a skilled nursing facility, from an emergency room, from a hospital. Maybe they're preparing for a medical procedure, and so they'll come into our space. That enrollment is paid for by their managed care plan, and then they're able to stay as long as their managed care plan allows them to. So typically about 90 days. And then we do have our crisis response team, and that is a team, a very small team. It's just one supervisor and two crisis response specialists that support our permanent housing environment. So we know that once someone is housed, that's not just the end of the support that they need. We want to help people stay safely in their homes. And a lot of the work that our crisis response team is doing is building relationship with folks that we know may need medical or police intervention at some point, so that those clients have a familiar face with our crisis response team if there is a crisis, and we can help them through that interaction with authorities or medical providers so that they can get the assistance that they need. So small but mighty team, and they are just all over San Diego responding to the needs of our tenants in our buildings. Next slide, please. And because we know that teens are really struggling, we have delved into the world of youth mental health and have started a youth mental health initiative through our therapeutic childcare program. This has been a really exciting addition to our therapeutic childcare services that we already provided, and has brought on adolescent therapists to provide care and mental health to adolescents aged 13 to 17, as well as their families. So I think I'm out of time. And I'll go back to Deacon Jim.
Thank you, Jesse. Thank you. That was very comprehensive. A lot that happens within your division there. I want to mention you started with prevention and diversion. That's so extremely important, as you pointed out. And one thing that I'll point out, a foundation which has helped us in that regard, and that's Copley Foundation. The Copley Foundation recently granted us $350,000 as a match challenge, and we went out to you, our benefactors and our strategic partners, asking for assistance meeting that match, and we've met that match. So we have $700,000 that we're able to utilize in our prevention and diversion efforts, which are so extremely critical, as Jesse had mentioned. So thank you for that. And now I'd like to turn it over. I'd like to turn it over to Dr. Parch, Megan Parch, who is our Chief Health Officer.
Thank you, Deacon. It's such a pleasure to be here with each of you, and I always learn something new. So grateful to hear from you tonight, Deacon. And Jesse, congratulations on the expansion to recuperative care beds. That is new news, breaking news here. So elated to hear that we'll be able to host more individuals in that critical program. So congrats to you and your team. Happy to be joining you to share about a place that's near and dear to my heart, about the Village Health Center. We'll go ahead and click to our first slide so I can tell you a bit about the integrated care services that we provide on our downtown East Village campus. So the Village Health Center is a federally qualified health center, which means that the federal government has appointed us as a healthcare for the homeless grantee of theirs, and they've charged us with providing services to anyone who comes in, whether that individual is insured or uninsured, has money, doesn't have money, whatever their needs may be. If somebody presents for services, we are here to provide for them. So we have integrated primary care, psychiatry, dental, and behavioral health services, which include both individual and group counseling. We have a nurse triage team, and this is special and exciting for our particular population because that means that when individuals walk in for care services and request access to a same-day service, because that's what is needed for them most, that they are greeted by somebody who's able to do a clinical assessment, who's able to really get down to what their primary concerns are, and in most circumstances is able to align them with the care service same day to meet that particular need. So whether that be a wound that won't heal or some intense pain in one of their teeth that keeps them from eating, we're able to assess and then address that need same day, which is care that goes far beyond what many of us are able to access, that's for certain. We have an on-site lab because we understand that in our experience of receiving healthcare services, when your provider says, okay, here's the list of labs in your area, go on out, find one of those fast in advance, get in there, and then we'll get those records in a few days and we'll get back to you. That breaks down systems of care. And for our patients who experience so many different barriers to getting into care in the first place, asking them to go to another place that they don't have transportation and support to receive the care services is unlikely. So we have an on-site lab where we're able to provide them with services, collecting specimens and either running it at the time of care itself to best inform the clinician who's supporting them, or to be able to get some rapid access to results within the next day or so and outreach to them to let them know what's going on. We do referrals to specialty care because as much as we like to be comprehensive in our services on our campus, we aren't able to do everything. And so for those few things that we aren't able to do in-house through our talented team and through the resources that we have at our disposal, we do refer out to other community partners. We have 2 full-time team members who focus on insurance enrollment and navigating benefits. If you, like me, have received a mailer from your health plan, it is like reading Greek. It's very difficult to discern what exactly is being said. And so for our patients, that's exactly the same. It's difficult for them to understand the information that's being presented to them. And they also have additional barriers where maybe they don't have a stable mailing address. Maybe they aren't receiving that correspondence. Maybe they lost their insurance card and they aren't certain which plan they have. Maybe they've experienced incarceration and they've changed plans, or they feel that they've lost their benefits. And so we're able to help them navigate those sorts of systems. We were realizing that there were so many people who could cross the threshold, but sadly, many individuals who could not. In fact, we had a lot of individuals who would commonly be around the health center, even living against the walls of our building, and yet never coming in to the health center. And so several years ago, we determined that we needed to be able to take care services to those folks. If you or I could suffer debilitating injuries or illnesses, and a provider could come to our home to render an in-home service, we felt that this was exactly the same way that we would do this for our community members. This is the way that we could provide the most dignified care, would be to take care to them, meeting them where they are in their space of residence, so to speak. And so we deployed a street health program in 2019, and that team goes out full time, Monday through Friday in the community, rendering primary care, psychiatry, and behavioral health services. The only service we don't take out is dental. Those chairs are really heavy. But anything else that we can provide in-house, we do outside of our 4 walls as well, acknowledging that there's so many barriers to care. We need to bring care to people in order to get them stabilized. And in fact, our most recent numbers demonstrate that individuals on average who are supported by street health have 3+ appointments with a provider. So that continuity of care is happening. Those relationships are being built. And then hopefully we're bringing them in-house and we're introducing them to the broad array of services on Father Joe's Village's campus. As Deacon so excitedly referenced, we have a detox program that's an expansion of our care services, of course, and that's going to be opening within the weeks ahead. Very excited for licensure to be rendered shortly by the state and for us to be able to begin to serve individuals in our community more fully, where we see that there is such a pressing, urgent need and so much unnecessary loss of life, sadly. We provide not only scheduled appointments, but also telehealth and same-day walk-ins, as I referenced, because we acknowledge that sometimes people need care in different modalities. Sometimes people need care when they need care, not in 3 weeks on a Tuesday at 2 p.m. For somebody who doesn't have a cell phone, who doesn't get the reminder calls, who doesn't have transportation, who doesn't have someone to watch their belongings, their children, their pets, these things are difficult to say, come back in a few weeks. And so really being able to address needs as they present is critical. We, of course, employ as many evidence-based philosophies in the way that we implement care as well. On to our next slide, please. You can see that in 2024, the Village Health Center was humbled to serve nearly 4,000 individuals, and we provided a ton of encounters here. What's notable, though, is that these are the encounters that are our care encounters. This doesn't speak to all of the lab encounters, right? So every time that someone was able to have a specimen collected, it doesn't speak to the number of times that we were able to support people with health insurance enrollment. It also doesn't speak to some of the other things that we do within our care philosophy, really holistically caring for individuals. When is the last time that you had a meal? Let's get you a sack lunch. I see that you have no shoes. Let's see if we have some in our donations. Let's grab you some. Your nails are very long and it's important that you take care of them. Can I get you some nail clippers? So there's all of these other things that happen that make the service more costly, but it also makes it more comprehensive and individuals more likely to stabilize and get the things that they need to then resolve their experience of homelessness. On our next slide, I wanted to talk very briefly about some of the barriers to care. I think, unfortunately, many of us come in with a mindset of if people are not working, if they are not housed, what else are they doing? How do they not get to healthcare? How do they not get to the provider to stand in line to see if shelter services are available? How do they not come to this place at this time? If they needed or wanted these things, surely they would. What we have listed here is just a handful, truly, of the barriers to care that the individuals that we support face, from trauma to shame to stigma to historical distrust of providers and vicarious trauma to disabling conditions, that sadly keep them from being able-bodied enough to engage with us, or mental health conditions that have them worried about whether they can connect with us or trust us. There's so many different things. Consider too, as we referenced, individuals who are homeless are at high risk for experiences of violence. If you have weapons, those are not welcome on our campus or in our health center, and yet you might need that thing to protect yourself. And so how do you grapple with, I want to engage in care, but will my care provider be able to engage with me? Can I bring the things that I really need with me into this care service? Pets, as Jesse referenced as well. We do host pets within our care services. We're probably the only care provider I know that has a crate available, and I will happily host pups and cats in my office if given the opportunity. But again, these are all presenting as barriers to traditional care. On the next click, in summary, if you don't know where you're going to sleep safely tonight or where your next meal will come from, it's really difficult to focus on some of these higher level needs, like consistent engagement in healthcare, with exception to the things that you just need to survive, like that wound that won't heal or that tooth that is keeping you from eating. On our next slide, just wanted to share some of the outcomes that sadly point to how critical it is that we engage people in these care services on our campus. Individuals who are unhoused on average pass 20 to 30 years sooner than their housed peers, which is a terrifying statistic. And additionally, as referenced prior, they're at higher risk for mental health conditions, violence, experiencing substance use disorders, and also one or more chronic health conditions. And all of those things combined are forces that lead to excess mortality. So those earlier experiences, those earlier fatalities of individuals who are unhoused. On our next slide, please. We've pointed to several times in our presentation how debilitating substance use disorders are for our population. And again, just speaking to how excited we are to be able to provide additional care services through our detox program very shortly. And finally, I believe I have a slide that shares a bit more about some of our innovative health programs that we've been able to open. And these truly are what bring me the most joy. In the decade that I've been at Father Joe's Villages, I've had the privilege and opportunity to participate in building and implementing many of these. And it's just been a wild ride and something I'm so very proud of. So within the last few years, we've brought on site 24/7 harm reduction vending machines that include things like naloxone to reverse overdose, and wound care kits and fentanyl and xylazine testing strips. We've implemented our street health program that I've told you about, from 3 mornings of the week to 40 hours out of the week, connecting people with the care services that they so desperately need. We've created a medication-assisted treatment program that is so robust, and we've been able to partner with UCSD and SDSU to test out new cutting-edge interventions like telehealth medication-assisted treatment services to see how that best suits, or does it best suit? I guess I gave away the punchline there. It does. Individuals experiencing homelessness and opioid use disorder. I've been able to participate in the creation of a recuperative care program that Jesse shared with you about, that we're building and growing and scaling, which is so exciting. Our 248 sober shelter that she shared with you, the RISE program, which we're so proud of, and then this upcoming 44-bed detox. And I'll just make a quick plug that one of the things that is so special between Jesse's RISE program and our detox program and the Village Health Center is that they're co-located. And so we have this mini continuum, this little system of care here within our building that's going to support people in those first steps in their recovery journey, and then some of the longer term sober shelter that they can access, co-located with those providers that they have created and can sustain relationships with for their primary care services, for preventative health services, to address those chronic conditions, to engage in medication-assisted treatment. And so Father Joe's Villages, at every step of the way, has a hand out truly for our community members, and is looking for ways that we can educate and outreach and engage at the time that folks are ready to then really fully embrace them in all of the care services and supports that are on our campus. So it's just a fantastic model, and we're so grateful to everyone who's on the call for your support. Turning it back to you, Deacon.
Dr. Parch, thank you. You know, what Dr. Parch won't do is brag about herself or her team, but I get to do that time and time again. And the reality is that a lot of the programs that have been basically have been instituted in just these last 10 years or so are proving to be models for the rest of the community. In fact, the Street Health, which began in 2019, about a couple of years ago, was mentioned on the dais of the county's Board of Supervisors as a model to be utilized throughout the county as a whole. So again, meeting people where they are, and that's exactly what that particular program does, right? The Street Health, and outreaching and building relationships so that people can then come and access medicine in a brick and mortar or in a hospital, whatever it takes, whatever will allow them to be able to prosper. And so that's just many of our programs. Dr. Parch mentioned recuperative care as well. That's yet another one. Again, people leaving hospitals, but not being able to live on the streets because of their circumstances. We don't want them to return to the hospitals, and providing that level of respite, and at the same time being able to build a relationship so that then we can help them into housing. That's what it's all about. So thank you, Dr. Parch, for what you do on a daily basis. Here in this next slide, you'll see one of our buildings. Actually, this is St. Teresa of Calcutta Villa. It is their residences here. In fact, there are 407 residences within this building. It was opened 3 years ago in 2022. It is the largest of our buildings, the largest of the buildings that we built, but it is also the largest of its kind in the history of the County of San Diego, built for our population, basically. So as I mentioned, it has 407 units, and 270 of those units are what we call permanent supportive housing, and I'll explain what the difference is there. Here we have 80 units for veterans, as an example. They're primarily studios, but we also have 1 bedrooms and 2 bedrooms as well. So it allows us really to serve a cross section of our population, many demographics, but whether it be singles, adults, whether it be families, whether it be seniors, and I've spoken about the need that seniors have, particularly at this time in the history of San Diego, but it's just a nice cross-section of the population. We made a commitment, and as we move into the next slide, we made a commitment to the community to build more affordable housing. As I mentioned on a prior slide, we don't have enough affordable housing. So as a result, the entire ecosystem is clogged. We don't have enough shelter beds. We can't move individuals into housing because we don't have enough housing. So we can't take more individuals off the streets. So that's why this is a focus of ours. So let me explain the difference between affordable housing and permanent supportive housing. All the housing that we build is affordable housing, and it's so that our population is able to pay the rent, either directly because they have some level of income, maybe SSI, maybe they have jobs, and some people work 2 and 3 jobs actually, but it's extremely hard to make ends meet in San Diego. And then there's also the vouchers as well that are available, and that's where permanent supportive housing comes in, the PSH vouchers. This is for individuals who have some level of disability. It may be physical disability, it may be substance use challenges, maybe mental health challenges, and that's where the PSH vouchers come in because that allows case management and allows us to be able to work with individuals long term, sometimes for the rest of their lives actually because of their circumstances, and that's what's so extremely important. I would like to say, just make a comment just on the PSH vouchers. There have not been any PSH vouchers made available in the last couple of years. And that's extremely impactful because it's through those vouchers that we as a provider are able to help, especially the chronically homeless, the most impacted out there in the community. And so in the absence of those vouchers, we have to rethink exactly how we provide services within the community. And that leads me to the next slide, which talks about our Turning the Key initiative. And we made a commitment to the community that we would have 2,000 affordable housing units to serve our population. And you see from this slide here that we have 900, at this point we have 900 such units across various buildings, primarily in the East Village, but we also have in the South Bay, we have a motel which we purchased and we converted it into 83 spanking new units, basically studio units. And so that's in the South Bay area. We also have on El Cajon Boulevard in North Park. That's one of our buildings as well, there as well. But right now we have a total of 896 buildings. As you go into the next slide, you'll see that we have a number of buildings in the pipeline, 5 to be exact, right? 3 of them are in the city of San Diego, and 2 of them are in the city of Oceanside. So we'll be moving into the city of Oceanside very soon as next year actually, to be able to serve that population there. They have an increasing homeless population there, and so we'll be able to serve them. One of the comments that I want to make here is as it relates to PSH, none of these buildings that you see before you on your screen will have PSH, will have permanent supportive housing units. Keep in mind, as I mentioned in the prior slide, that St. Teresa of Calcutta has 2/3 of its units as PSH, 270 of the 407 units, right? So that allows us to serve the very severely impacted. None of these buildings will have PSH. Why? Because the PSH vouchers are not available, right? And so we're working and we're advocating with the politicos in the area and the like to be able to really address that situation. And these PSH vouchers primarily come from HUD and federal HUD. And so more and more we're having discussions along those lines, right? And not only are new vouchers not being made available, but we're concerned because there's talk about the fact that existing vouchers may be pulled, and these vouchers have to be funded on a yearly basis. And once an individual has these vouchers, unless their circumstances change and they improve substantially on the financial side, they'll have those vouchers for the rest of their lives, because our population, for the most part, will never be able to afford market rate. And so the thought of those vouchers being pulled from individuals who have had them for a number of years is a very scary proposition, because that means that inevitably they'll fall onto the streets. And if that was to happen, we'll see an increase in the number of individuals who are homeless. So again, we're keeping an eye on this, and not only keeping an eye on this, but we're speaking locally on it, and we're also having conversations at the federal level as well, right? And to make sure that our voices are heard. One of the buildings that you see here in front of you, the one on the lower left corner, actually, is a building that had been awarded $7.5 million at the tail end of last year. It was a HUD grant that was awarded, and that $7.5 million was going to allow us to tap into $4 additional million state funding. Well, unfortunately, about 6 weeks ago, we received a notification from HUD that grant, even though it was awarded at the tail end of last year, would not be paid. And so the loss of that $11.5 million has caused us actually to set back the groundbreaking for that building, which was going to be at the tail end of this year, into next year. Now, of course, it's not a matter of not moving forward. That's not an option. People are struggling and are suffering on the streets. We must deploy these buildings. So it's a matter of being able to go out, and I'm blessed with a great staff in our various divisions. You got a sense of Dr. Parch and of Jesse. Similarly, on the housing development side, I have just an ace team there, and they're going down other avenues basically in order to obtain other funding for not only that building but the other buildings as well. So it just gives you a sense of the challenges that we have. We're confronted with challenges, and it's meeting the need, and that's what it's all about. So together we prevent and we end homelessness one life at a time. Well, as I've said before, by together I mean you and us combined. I alluded to the external factors already on this slide here. I pointed to a few concrete ones, loss of various funding. We see that, of course, that inflation has been rearing its head now for the last at least couple of years. So there's that economic uncertainty, people feeling apprehensive about their situations, right? And so this is in the midst of it all. We need to make sure that we continue to be a lifeline in the lives of these individuals. Here are just a sense of some of our strategic partners, right? You see, I've mentioned the David C. Copley Foundation is one of them. It's centered there, but we also partner with other various providers as well, such as PATH and the San Diego Food Bank, of course, some of the educational institutions as well. That said, the number one source of our revenue and being able to really provide the work that we do, I know I've said it before, is you. Philanthropy is what makes up the lion's share of the revenue that we have and the assistance that we have in order to continue to make a difference in the lives of these individuals. You have chosen to invest in our work, right? You allow us to continue the legacy that Father Joe Carroll himself started a number of years ago, back in the 1980s. You allow us to continue to recognize the humanity and the inherent dignity that we all share because we're made in the image of God. And we've been able to grow and evolve as a result. So now we stretch from just about Chula Vista, I mentioned the South Bay area, into here in San Diego, the city of San Diego, and now soon to be in the city of Oceanside as well. And again, innovation is what it's all about. Not staying static, but making sure that we're consistently meeting the need of these individuals at any given point in time. And you've seen that, as was mentioned before, the detox center, which we'll be blessed to have open within a couple of weeks, is an example of that. It's a matter of providing holistic and client-centered approach, not just a cookie cutter model, but making sure that we're really being responsive so that we can be most effective in the lives of individuals. We can address the root causes of their situation and be able, those precious dollars with which we're entrusted, we'll be able to use them as efficiently as possible. And as a parent, you know, we're a living laboratory. I mean, we learn from our neighbors, right? The successes that we have inform our strategic direction for the future. And in fact, there are times where we repurpose programs and we shift around funding dollars. Why? Because we may go down an avenue that is not as effective as we think it should be. It's about empowering our unhoused community to create their own lives, basically, and their paths, their individual paths. Your investment makes a difference. So as you see here, in this particular slide here, you know, we have to ask ourselves, I mean, if not us, who's going to do it, right? We are fighting homelessness, not because it's easy, but because it's hard. And it is hard. If it was easy, it would have been solved ages ago. But the reality is that it is complex, and it's complex because human beings are complex. And so we need to make sure we meet them where they are in order to be most impactful in their lives. So I thank you for joining us, right, to prevent and ending homelessness one life at a time. And I ask you to please consider, if you can, making an additional gift or giving more this year in order to mitigate those external circumstances and external forces that I mentioned before. And here on this slide, you see the various ways of being able to do that. We have our online QR code, but we also accept checks and stock donations and the like. There's also, what's not on here, but we have our retail stores, and people they are able to donate gently used items and furniture and boats and cars and so forth. And these are items that we either have them at our retail store, or we're able to auction them off in our auction houses as well. It's all for the purpose of being able to provide services. Planned giving, if you want to leave a legacy, that's such a great way of doing it. The Amber, who told her story in her video, was she just happens to be on the front cover of this year's edition of the Blue Book. We publish this on a yearly basis. I encourage you to take a look at this book. It's jam-packed with information on homelessness as a whole, and specifically on the work that we do in this space. Right? It's a story of impact, of lives changed, of hope restored, of community built, and that's what it's all about. So you've been very kind and patient at joining us here, and I hope we've been able to share and you've been able to really grasp what we do here as an organization, what we've done for the last 75 years, and what we will continue to do, because we must. There's a humanitarian crisis out there on the streets, and we must be impactful, we must react to that. So with that, what I'd like to do is open it up to some of the questions that have been submitted. And let me just take number one. If homelessness is increasing for seniors, are you planning on doing new senior services, it says here? And the reality is that we are. And we are planning on it, and we are already into the space of seniors. It was Jessie in her presentation who mentioned the beds that we are operating at the village, Veterans Village of San Diego. And that's an example. We purposely wanted to allocate beds there for the senior population. Why? Because we're seeing more and more individuals falling on, seniors falling onto the streets. It was Jessie also who mentioned prevention and diversion. This is a population that would benefit tremendously from prevention dollars, keeping them housed. You know, a shallow subsidy of $500 to $600 can be the difference between a person who has a home, has an apartment, staying in that apartment, or falling onto the streets. And you may say, well, hold on, $500 a month is $6,000 a year. That's quite a sum of money. But that said, it's a lot more costly when an individual falls onto the streets. It's more costly financially. It's more costly as far as the impact and the trauma to individuals once they fall onto the streets. So really just providing a shallow subsidy makes a difference in the lives of individuals. Food pantry is another. I mentioned that 25% of those who are on the seniors who are on the streets are food insecure. So our food pantry line has been growing tremendously, though I have to say that we've had to cut it back from 1 day a week to 2 days a week because of the circumstances, because of the funding that has been pulled back. But the reality is that we continue it continues strong, and the lines are down the block as cars pull in for just the box of staples, as an example, and fresh produce and the like, so that they can, yet for another week, they're able to feed themselves and their families. So that's important. There's another question here. Are there some individuals who will never be able to reach self-sufficiency? How do we support them? Well, the reality is, and I think I alluded to this, that there's some individuals on the permanent supportive housing side who need our support for the rest of their lives. Sometimes it's hard to understand that, but you have to understand our population, those who we're blessed to serve. The reality is that some of them are so severely impacted because of their circumstances that they need support for the rest of their lives. And that's okay. That's what we do. We do it well. We're known for that. One of the things that has not been mentioned, I don't think Jesse mentioned it, is that there are other housing developers who, that's what they do. They develop housing, but affordable housing, but they don't have the expertise to provide services, and they contract with us because we're known for our services. And so we're able to provide, there are affordable housing buildings out there that are not ours, and yet we're providing the services, especially on the PSH side. Why? Because these are individuals that, if not for the support that we provide, they would be on the streets, right? It's just sad reality. So anyway, I hope that answers that question as well. There's another question here. It says, what is Father Joe's Village's relationship with the mayor of the county and the governor? We have good relationships. I would add to this, the city council as well. We have very good relationships, and a lot of the work that we do needs the support and the collaboration that we have with our government officials. So that, as an example, again, as far as the detox center is concerned, Councilmember Campillo, Raul Campillo, was someone who helped expedite permitting there, and that's because he looked at the land use codes and recognized that there was an opportunity to present to the full council changes to the land use codes, and they were adopted unanimously, and as a result, that helped to expedite permitting in order to be able to open the center. That wasn't just done for us, obviously. We benefited from it, but also it helped other entities as well. So that's just one example. Speaking of detox center, we approached the governor's office recently to make sure that we could expedite the state license that we needed in order to open up the center. And so we fell back on our those who we know are partners at the governor's office, and they were helpful in that regard. On the county side, we work with the County Board of Supervisors, especially when you think about, you probably heard that Medi-Cal has been threatened in the sense of being reduced, and that's impactful to our population. We have a Medi-Cal population, and so we've been advocating at the county level and working with them, and our hope is that through that work, there'll be funds released that will fill any gap left by any cuts to the Medi-Cal. So I hope that answers that question. And this next question, I'm going to turn it over to Dr. Parch, and it has to do with the detox center. When someone goes through detox, where do they go after that? I mentioned that we have recovery beds, and of course that's an avenue, but there are other avenues as well. So Dr. Parch, would you like to share that?
Yeah, of course. Thank you. So, as I'd referenced very briefly, detox truly is just the first step in a journey that somebody is taking in this present moment. And so, detox on average is about a 10 to 14 day stay. And so, you can imagine that after many years of experiences and potentially substance use, mental health, unattended to care of one's body and experience of homelessness, a 10 to 14 day stay in a more structured environment and program to safely withdraw from substances is just the tiniest step in a journey ahead. And so we have a number of community partners that provide really fantastic residential treatment. There's a lot of longstanding institutions in San Diego that support this work, one of which is McAllister Institute, and they have provided us with technical assistance throughout the creation of our detox program, in fact. So we've been able to lean on them as partners, but they very commonly are a referral source for us as we are sending individuals from our services into longer term residential substance use disorder treatment. And they're one of many amazing partners that we're able to rely on. One of the things that we know about our system of care when it comes to substance use disorder treatment is that oftentimes when somebody is ready, and we as providers want to strike while the iron is hot because motivation can kind of ebb and flow, sometimes a bed or availability of the service is not fitting with the need. So the person presents and says, I'm ready, today's the day. And sadly, as service providers, we say, there are no beds, there is no access, there is a wait list. Well, call back, we'll be in touch. So the additional beds that we have are really a phenomenal way that we can enhance access to give people more ready access to care so that they are not continuing to be experiencing homelessness and substance use disorder on the streets. But one of the other things that we know, aside from kind of these breakdowns, because when somebody's ready, the bed's not available, is that when they complete detox, oftentimes the bed at the next level of care, that residential treatment service, is not available, which is where Jesse's team's RISE program again comes in as such a godsend, because we can then send somebody temporarily to this safe, sober shelter environment for 2 days, for 17 days, whatever that kind of bridge timeline is before they transition to that longer term residential care service, with hopes then that continues to help them to promote their recovery gains, further stabilize their health, and then be able to move on to those additional next steps. So thank you to whomever posed the question. It's a great one.
Thank you, Dr. Parch. So I want to wrap it up pretty much here. Just want to mention a way of getting involved is attending our upcoming events and sponsoring and helping with our upcoming events. One is our golf classic, and that will be this month, towards the end of the month. It benefits our veterans. The 5K, and this will be our 24th annual 5K, and it's a lot of fun that benefits the meals that we serve. Our gala, that's not mentioned here actually, on May 2nd of next year, benefits our families in our therapeutic childcare center. Of course, we'll be appreciating our donors at our annual event, and this year's going to be on October 15th. So be sure to join us there. So thank you again for joining us, and most importantly, thank you for making a difference in the lives of those who we are blessed to serve. You believe in them, we believe in them, and that's because we do feel that we have a common humanity. And so thank you for that, and God bless you.